We just heard some stories from healthcare workers. We're here in Edmonton, Griesbach with our candidate Blake Desjardins. And we heard from nurses, EMS, and workers that work with seniors in long-term care, a worker that works with seniors in long-term care. And if you heard any of the conversation, what's happening right now in Alberta is desperate. These workers are desperate. One of the nurses was sharing a story of people being admitted and kind of the shock in their eyes. These are folks that have been infected with COVID. They come into the hospital and their eyes finally are just realizing that this might be my last moments. They're struggling to breathe. They got respiratory therapists with them, doctors with them. And these are workers that got into healthcare to save lives, to provide the best care possible, but they can't do that. And I want them to know it's not their fault. Like if you hear the care and the passion and the love in their voices, these are folks that care about their patients, they care about the community, they want to do everything. But because of cuts to healthcare, because of the current Conservative government's cuts to healthcare, and because of the federal government's cuts to healthcare, these workers are not given the resources, the staffing, and the hours. Like this is desperate. Nurses are coming into work just when they're supposed to have some time off after being already overworked and stressed out, and they're coming in on their days off despite having worked overtime for month after month after month. These are workers that are burnt out, they're dealing with the pandemic, and they're still being asked to do more, and it is rough. We know the recent release came out asking for the Canadian government to step in and provide military support, and that's how desperate things are. We support that call. We need to get help here. These workers are saying that we are maybe a week away from having to decide who gets care and who doesn't. That means people are going to come into the hospital desperate for care with life-threatening illnesses, and a doctor, a physician team, a nurse team is going to have to decide who lives and who dies. In Canada, in the 21st century, that's the type of decisions that workers, that frontline healthcare workers are going to have to make because of the cuts, because of how bad things are. We want these workers to know we have their back. And we want Albertans to know New Democrats are going to fight for you. We're going to fight to invest in our healthcare system. We're going to fight to invest in you. Blake is going to be a champion for you, to fight for you, to lift up your voices, and to make sure we invest the funds necessary to defend our public healthcare system, to make sure that these workers aren't up against the odds. They're given every resource possible so they can do their best jobs. And that's what they want to do. And they're still doing it against the odds. I just want them to know that we have their back and we support them. We're going to invest in healthcare. You've got a choice in this election. Mr. Trudeau, who's continued those same cuts, or New Democrats who are going to fight to invest in your care. Ready for any questions you might have. On est ici pour partager les histoires de ces travailleurs en santé. Ils ont partagé des histoires désespérées parce que la situation est dangereuse à ce moment. Donc, on veut dire que nous est là pour vous, pour les travailleurs et travailleuses en santé de première ligne. On est là pour les gens. On veut investir dans nos soins de santé. Les conservateurs dans cette province et les libéraux ont coupé les investissements dans les soins de santé, et à cause de ça, on est dans cette situation. On veut augmenter les investissements pour aider les gens. Vous avez un choix dans cette élection. M. Trudeau et M. O'Toole qui coupent les investissements dans les soins de santé, qui protègent les intérêts des autres riches, ou les néo-démocrates qui se battent pour vous.
First question, Karina Roman, CBC News. Hi there. Why is it a good idea to come and campaign here in a province where we have a state of an emergency? Can you walk us through the decision making in that? What did you weigh? What factors did you weigh where you decided, you know what, it's a hot spot, but we should still be campaigning in this province at the end of the campaign?
We were looking at the situation in Alberta and how dire the situation is, and made a decision that leaders have to show up. And we showed up to speak with healthcare workers to make sure that their story is heard. We've got the national media here. We want national media attention on how dire things are here for these workers. These workers are breaking down emotionally and physically because they are giving it their all to save lives. And it should not be this way. So we wanted to give the platform that I have, that our team has, to these workers, to let them know we've got their back, and Albertans, we've got your back. We don't accept what Mr. Trudeau said, that it's not his job when people are suffering, when people are dying. He said it's not his job. I believe it's my job to find any solution possible, to find any way to help. And so first and foremost, we're here for these workers, we're here for Albertans, we're here for healthcare workers, and we're here to save lives. We know that if we invest in healthcare, we can defend the public healthcare system, we can save lives. And that's what we're here to do, to give voice to these workers, to give voice to Albertans, and to raise the concern that people are going through right now.
Thanks. Bertrand Oliver, CTV News. Hi, I'm just going to follow sort of my colleague's question. When you were here earlier this month, you did meet with a group of healthcare workers. You talked to them about the issues they're facing, especially with burnout, with the stress of their daily jobs. Why this time, when the risk is so high, did you decide to come here when you've held virtual events previously with hundreds of attendees? Would that not have been an opportunity to reach far more healthcare workers rather than just a select few? Would your message not have been much broader and safer virtually rather than in person?
The situation has gotten so much worse. Just in a couple of weeks. When we were here weeks ago, things were bad. In those weeks, things have gotten even worse. Things are so bad right now. We made a call to use our platform, to use our campaign to draw attention to how bad things are and to call for help. We know that the call right now is to have the military come in. We are echoing that call to prevent the dire outcome of having to decide who lives or dies, for patients who come into the ICU, who come into the hospitals. We are echoing the call and the demand to have the military come in immediately to provide that support. We wanted to come here because it's that serious. It's that important that I wanted to be here on the ground to say, we need to support the people here in Alberta. We need to support these healthcare workers, and New Democrats are committed to that.
Next question, Alex Ballingall, Toronto Star.
So you've just heard these heart-wrenching stories from these healthcare workers here about what's going on in Alberta. You've also, I'm sure, heard Aaron O'Toole's previous praise of Alberta as the government's response to the pandemic. Why, during the campaign, will you no longer rule out supporting a Conservative government in the next Parliament?
Well, I've been really clear. Conservative premiers like Mr. Kenney have been an abject failure. They have failed people, and people are dying, and people have died because of his failure of leadership. Mr. Trudeau called an election knowing full well, we all had received the same briefings, that there was a fourth wave that was imminent. Knowing that the fourth wave is imminent, knowing that we're still in a pandemic, he called an election. That means we weren't in Ottawa able to help people, weren't in Ottawa to make decisions that would actually save lives. That was a horrible decision and a horrible lack of leadership. So I want to be very clear. I think Conservatives have shown an abject failure in leadership, and I think Mr. Trudeau, as a Liberal, has shown an abject failure of leadership. And that's why I really believe people are better off if they vote New Democrats. We will fight for you. We will stand up for you. We believe in our public healthcare system, and we will invest in it.
Jean-Sébastien Cloutier, Radio-Canada.
Monsieur Singh, Monsieur O'Toole s'est engagé aujourd'hui à ne pas déclencher d'élections anticipées s'il formait un gouvernement minoritaire. Est-ce que vous engagez la même chose? Quelle est votre position là-dessus?
On a toujours dit qu'on ne déclenche pas une élection dans une pandémie. On a demandé à M. Trudeau à plusieurs reprises qu'il doit aussi s'engager de ne pas déclencher une élection, et il n'a pas le fait. Donc, on a un choix maintenant. Quelqu'un qui brise ses promesses et les gens paient le prix. Quelqu'un qui protège les intérêts des autres riches, comme M. Trudeau, ou les néo-démocrates qui se battent pour vous.
Next question, John Iveson, National Post.
Mr. Singh, on the first day of the election, Justin Trudeau politicized the vaccination issue when he was talking about mandatory vaccines, seemingly using it as a wedge against the Conservatives. Do you think that has been counterproductive in provinces like Alberta to getting people vaccinated? People just said, Justin Trudeau wants it, so I'm not doing it?
Sadly, I think so. I think Mr. Trudeau has tried to benefit off of making this a wedge issue. He's been inflammatory about it. And that's why we actually called all leaders to come together to make sure it was absolutely clear that all leaders believe in getting vaccinated. And I want to acknowledge that Mr. Trudeau agreed. to come to that. Mr. O'Toole agreed, Mr. Blanchet agreed, and I was there, of course, and Ms. Paul agreed. I want to acknowledge the leadership that was shown in that moment to not politicize getting vaccinated. Though I think there was an attempt maybe in the beginning to do so. Now it is clear. All leaders agree, conservatives, liberals, New Democrats, the Bloc, everyone agrees. While we are in the last days of this election, and I want you to vote for New Democrat, I think we will be the best option for you. We will fight for you. I think Mr. Trudeau is not the way to go. I think he protects the interests of the ultra-rich, and he's been all for show, and it has hurt people, and people have paid the price. I still want you all to know that no matter who you vote for, all parties believe you should get vaccinated. Even conservatives, it's not a partisan issue. Everyone agrees. So please get vaccinated, and please get out to vote.
De TVA Nouvelle.
Bonjour, Monsieur Singh.
Oui, bonjour.
L'Alberta est en train de traverser cette quatrième vague de COVID-19 à son pire moment. La situation ici est complètement critique. Est-ce que c'était sécuritaire de venir faire campagne ici quand même?
Oui, on a pris des mesures sécuritaires, donc on n'a pas eu un grand rassemblement de gens. On a décidé de faire ça par respect, d'avoir une petite rencontre. Mais c'était important d'être ici parce que la situation est assez pire. On a pris une décision difficile pour dire clairement que la situation est dévastatrice. Maintenant, c'est vraiment critique et on doit aider les travailleurs en santé. On est là pour vous, les Albertains, mais on est ici pour les travailleurs en santé. On est là pour vous.
Roman Williams from the Globe and Mail.
Mr. Singh, I'm going to follow up on a question from earlier about the choice to travel to Alberta at this time. Can you share with us the specific steps that you and your team went through to assess that it was still safe to make a campaign stop here, and walk us through the factors as well to make sure that this visit was done safely?
We decided to have a small gathering, not a large rally, make sure that we kept space. And the situation was so bad and the situation is so dire in Alberta, we had to come here to make a strong show of solidarity for the frontline healthcare workers, to let them know we've got their back, to echo their demand to have the military come in and provide all the supports necessary, and to make the final case that if you believe in defending our public healthcare system, you've got a choice in this election. Mr. Trudeau has been all for show. He has said a lot of things, but he hasn't backed them up, and he has made people pay the price. You Democrats are here for you. We will fight for you, and that's the choice you have in this election.
Next question, Olivia Stefanovic, CBC News.
Hi, Mr. Singh.
Hey there.
Throughout this final week of the campaign, including this morning, you've offered, for the most part, very vague answers and haven't been clear about what you would do, especially in a minority government situation. You continue to repeat the same talking points. Do you think Canadians deserve a Prime Minister who doesn't answer questions directly?
I think Canadians deserve a Prime Minister who's going to put them first. Prime Minister who's not going to say it's not his job when people in Alberta are suffering, when people are dying, and he throws his hands up and says it's not his job. I believe people need a Prime Minister who says, we're going to fight for people. We're going to do everything we can to invest in our healthcare system. And we're going to make sure we invest in having a paid sick leave program to save lives. We're going to immediately release a federal vaccine passport so that people can travel across the country and travel internationally knowing that they're vaccinated. We're going to make sure that we have a Prime Minister that protects people, not the ultra-rich. As Mr. Trudeau has done many times, he has sided with the ultra-rich, not with people. You Democrats are here for you. We're going to fight for you. You know where we stand, and we want Canadians to know you've got a choice in this election. And that choice is very important. And as you're thinking it through, do you want someone who has said a lot of things that sounded nice when you heard them, but has not delivered, and people have paid the price for that? People have been hurt. People have been hurt by that. Or do you want New Democrats who are going to fight for you? We're going to stand up for you. We're going to lift you up.
Holly Malone with Canadian Press.
We heard from these workers today talk about burnout, layoffs, hours, and distribution of resources and more. But health is a provincial jurisdiction. How would you have ensured that things were done differently?
Well, one of the things that we've seen over the past number of years is that federal governments have been cutting healthcare. They've been cutting healthcare funding. And Mr. Trudeau criticized Mr. Harper's cuts to healthcare. I agreed with him when he criticized Mr. Harper's cuts to healthcare. Then Mr. Trudeau took office and maintained those very same cuts. Those cuts to healthcare hurt people. And these workers have shared their stories of what those cuts mean. When provincial governments cut healthcare, and when federal governments cut healthcare funding, people pay the price. People are hurt. People don't get the care that they deserve and they need. And that's why I'm saying to Canadians, do you want someone who's promised to increase healthcare funding, who has actually maintained the same Harper cuts, who's protected the super rich, or do you want New Democrats who are going to fight for you, to fight for our public healthcare system?
En français, s'il te plaît.
On respecte énormément qu'il y a des chambres de compétences provinciales et fédérales, mais on sait aussi que les coupures dans les investissements, les transferts en santé ont fait mal, ont blessé les gens dans les provinces et territoires. Donc, M. Trudeau a critiqué les coupures de M. Harper, et puis, quand il est devenu Premier ministre, il a maintenu les mêmes coupures. C'est la mauvaise chose à faire. Donc, ces coupures blessent les gens. Et ces travailleurs et travailleuses de première ligne en santé ont expliqué comment ces coupures blessent les gens. Et c'est pourquoi on présente notre offre dans cette élection. M. Trudeau a parlé beaucoup des soins de santé, mais les a coupés. Il a maintenu les mêmes coupures de M. Harper. Il n'est pas de votre bord. Vous pouvez choisir les néo-démocrates qui sont de votre côté, qui vont vous défendre.
Conference. Thank you, merci.
Merci. Thanks so much.